Hello, everyone. This is Michael from Western Reserve Independent Living Center, coming to you with our latest newsletter. Wrilc's Independent Living Newsletter, Issue 22-4, April 2022. Western Reserve Independent Living Center, opening doors to independence. In this issue, Section 1, What is Self-Advocacy? Core Service Spotlight. Self-Advocacy. Section 2, Wrilc's Services Update. Section 3, How to Ease Back into Life After the Stress of COVID-19. Section 4, Monthly Book Recommendation, Tech Corner, Recipe. Leftover Easter Ham Breakfast Egg Nests. Section 5, What is Cat 41? Section 6, Wrilc News and Events. Section 7, Calendar Items for April. Section 1, What about Self-Advocacy? Core Service Spotlight. Self-Advocacy. What about self-advocacy? Centers for Independent Living often have a diverse staff that can provide a range of services. However, in order to best use these services, an individual also needs to be a good self-advocate. Being a self-advocate is about first knowing what you need, and then it is about being able to stand up and ask for what you need. Here are 3 tips for being a good self-advocate. Know what you need. This can be a difficult part of being a self-advocate. We all have different needs, and sometimes we need help identifying what these needs are. Western Reserve can help you identify these needs, create a goal plan, and reach your goals. Trust yourself. Remember, the key to consumer choice is that you are in control. You are the best expert on your own needs. However, this doesn't mean that you can't get help and advice from others. Staff members of SILS are trained to help you and can be excellent resources. Ask questions. Perhaps the most important tip to be a better self-advocate is to remember to always ask questions. Asking questions and discussing your concerns with others is a critical step in knowing what your needs are and being confident in that knowledge. If you don't understand something or need more information before making a decision, ask. Section 2, Wrilc's Services Update. Persons with disabilities are at greatest risk for severe illness and death from COVID-19. If you need help with finding a vaccine site, finding vaccine information and facts, finding transportation to get your vaccine or booster shot, finding an accessible vaccination site, appointment reminders, call us. We can help. 330-372-3325. Section 3, How to Ease Back into Life After the Stress of COVID-19. Just a few weeks ago, the Centers for Disease Control and Prevention, CDC, reported that more than 90% of the United States population lives in an area with a low or medium level of COVID-19 cases. Schools across the country have been easing mask restrictions. Mask guidance has also been dropped from public indoor settings, excluding healthcare facilities. With this latest dip in COVID-19 cases, it seems that the country is returning to normal. And while that's exciting for some people, for others, the return to normal is fear-inducing. Quote, "We've spent the last 2 years of our lives in a pandemic, and we don't fully understand how it has impacted us yet," unquote, says Deborah Beinstock, MSW, a behavioral health specialist at Henry Ford Health System. Quote, "We've had this cumulative stress and anxiety for so long, and it affects people differently. While some haven't been able to wait to rip their masks off, others are having trouble snapping back into life as it was before the pandemic," unquote. While these pandemic years have been difficult and scary, here are a few things to keep in mind that might ease your fears. 1. We now have vaccinations. When the pandemic began, there weren't vaccinations to protect us from the virus, which was why we had stay-at-home orders. But now, being up to date on your COVID-19 vaccinations can make you feel protected, especially if you are otherwise healthy, as those who are vaccinated are less likely to contract and get seriously ill from COVID-19. 2. We know much more about COVID-19 now than we did in the beginning. When the pandemic began, doctors knew little about how the virus spread, how to treat it, how it behaved, and its symptoms. Now, 2 years into the pandemic, we have much more research and data that helps us to know what to expect, how to protect ourselves, and what treatment methods can be used. 3. Right now, the data tells us that cases are low. The CDC has eased mask guidance for most of the country, and their decision came from a place of research and data. Quote, "I think what's scary is that information can change quickly," unquote, says Beinstock. Quote, "You hear one thing, and then it may change a few months later," unquote. We don't know what will happen in the future, but we do know that right now, pandemic recommendations are based off of credible information. That said, everyone has to go at their own pace. Even if you are vaccinated, and just because cases are low, it doesn't necessarily mean you'll feel comfortable letting your guard down. Here are some tips to easing your way back in. Start small. If you've been reticent to go out in public, you don't have to start off by going to a crowded venue. Quote, "Try dining at a restaurant during off hours at a time when it won't be that busy," unquote, says Beinstock. Continue wearing masks in public places. It doesn't matter if other people aren't wearing masks. If it is something you want to do, wear a mask. Quote, "Don't feel pressured to follow the crowd," unquote, says Beinstock. Quote, "Make decisions based upon what will make you feel safe," unquote. Focus on the present moment. If COVID-19 worries are eating at you, shift your thoughts to what you can control and think about the moment you're in. Quote, "Tell yourself, right now, the risk is low and cases are down. I'm making a decision based on the information I have in this moment. I'm keeping up with the CDC guidelines, unquote, says Beinstock. Quote, we have to think about what we can control and try not to go down the path of what ifs, because there is always a what if. Incorporating mindfulness tactics into your daily life, meditating, doing breathing exercises, engaging in a relaxing activity like doing a puzzle or knitting can help refocus your mind into the present. Quote, everyone has a different comfort level and some are more vulnerable than others, unquote, says Beinstock. Quote, we are all going to respond to this differently, and the best way we can do this is to be patient and understanding with each other. And if this is something you need help with, don't hesitate to reach out to a professional, unquote. Section 4. Monthly book recommendation, Tech Corner, and recipe. Book of the Month recommendation. Thriving Blind, Succeeding Without Sight by Kristen Smedley. Blindness. A tough topic to discuss? Not anymore. In this groundbreaking book, readers will see blindness in a whole new light. In fact, the compelling and entertaining stories will not only change perceptions of blindness, they'll make readers forget the people featured are actually blind. Author Kristen Smedley's journey began with devastation and tears after her two sons were diagnosed as blind when they were each just 4 months old. Eventually, she met a few people who would change her perception of what is possible for those navigating the world without sight. Those role models were the tipping point for Kristen and her sons to move from surviving blindness to thriving. Thriving Blind introduces the reader to 13 of those pivotal people, including a reality TV star, YouTube sensation, and Teacher of the Year. Tech Corner. The Empathy Board Game. Games can be the perfect tool to introduce and teach social-emotional learning skills to kids and young adults. These are the skills that help kids become more self-aware, develop positive relationships, show empathy towards others, manage emotions, use self-control, resolve conflicts, and make positive decisions. Considering and understanding the feelings of others is a foundational skill that supports social success. In order to know the right or socially appropriate response to situations, we must first really understand how others feel. To learn about this and other games that will help with social emotional learning for kids with autism, go to https://www.thepathway2success.com/using-games-to-teach-social-emotional-skills. Recipe. Leftover Easter ham breakfast egg nests. Ingredients: 20 ounces hash brown potatoes, 12 large eggs, 1/2 cup whole milk, 2 green onions sliced plus more for garnish, 1 cup cubed ham, 2 cups cheddar cheese, divided, salt and pepper, butter, and non-stick spray for greasing. Instructions. 1. Preheat oven to 425 degrees. Generously grease muffin pans and set aside. In a large bowl, combine hash brown cut potatoes and cheese and mix to combine. If you are using frozen hash brown potatoes, make sure they are thawed before using. 2. Press potato and cheese mixture into the bottom and up the sides of all 16 greased muffin cups, making sure that the sides come out the top of the muffin pan just slightly, as they will shrink while cooking. Season each potato cup generously with ground sea salt and pepper. 3. Bake at 420 degrees. 3. Bake at 425 degrees for 20 minutes until edges are golden and potato is tender. 4. Meanwhile, in a large bowl, whisk together eggs, milk, green onion, ham, and cheddar cheese. Season with salt and pepper. When potato cups are done baking, remove from oven and fill each with about 1/4 cup of filling. 5. Reduce oven temperature to 350 and bake an additional 12 minutes or just until egg cups are set and puffed. 6. Remove from oven and allow to cool slightly until you can handle them. Carefully run a small offset spatula around the side of each egg cup, helping release it from the muffin pan. 7. Serve with a dollop of sour cream and a sprinkling of green onions. Kitchen tips. The hash brown, egg, ham, and cheese combination is absolutely to die for, flavor-wise, and makes such a great day after Easter breakfast or meal prep idea to enjoy all week long. If you aren't serving these little nests on the day you bake them, simply store in a Tupperware container and reheat in the oven or microwave for a quick and delicious breakfast anytime. Also, feel free to let your creativity shine by adding your favorite omelet add-ins. Did you know? Easter fun fact. The act of painting eggs originates from a Ukrainian tradition. For countless centuries, Ukrainians have been decorating eggs as a calling out to the gods and goddesses of health and fertility. This traditional act of pisanka is made by using wax and dyes, but this colorful custom didn't take off until Ukrainian immigrants came to the U.S. Section 5. Cat 41. This month, instead of transportation news, I want to share information about our consumer advocacy team, Cat 41, as the world opens back up and we begin our new normal. We are once again able to meet in person and would like to know who is interested in resuming our Cat 41 meetings. What is our cat team? Our advocacy specialist, Carl Clemens III, answers this question. Cat 41 was created because of the power of the consumer. While in college, my economics professor taught me a lesson that consumer spending made up 70% of the GDP. So I created CAT, Consumer Advocate Team. The idea was to teach them to advocate for themselves. I wanted them to learn to voice their opinions on life's problems that affected them. I believed that a team probably had similar problems, and collectively they could help one another. The 41 came from my background in sports. You are not better than the team, but each individual could bring something to the team. The 41 stands for a quarter, a dime, a nickel, and a penny. 4 coins, regardless of denomination, has a place on the sum equating to 41 cents. The most important coin getting to 41 is the penny. You cannot get to 41 cents without the penny. Therefore, the individual has an extreme amount of power, and their opinion should never be dismissed. Our CAT team discusses everything: transportation issues, medical problems, exercising, and how to use a glucometer. My passion for transportation equity is driven by its necessity to survive in this world. When I first came to Wrilc, transitioning people was the most important thing. Debbie's son Jeremy stated that he hated transportation. I replied, "What good is a home if they cannot support it with transportation? We are all a bunch of shiny pennies in a powerful bank." Quote by Carl F. Clemens III. If you are interested in or want more information about the CAT 41 team, contact Carl Clemens at 330-372-3325, extension 108. Section 6. Wrilc News and Events. Independent Living Skills Workshop, Fridays, 1 to 2:30. This month's topics: April 1st, Technical Skills; April 8th, Budgeting and Finance; April 22nd, Healthy Relationships; April 29th, Transportation. Call for information or use the link below to join. https://us02web.zoom.us/j/88391571881. Meeting ID 88391571881. Passcode 979606. Or call 646-558-8656. Monthly online peer support. Stress and Anxiety Peer Support Group, Wednesday, April 20th, from 11 a.m. to 12 p.m. This month's topic: The Psychology of Clutter. Why spring cleaning may help with your stress. Virtual meeting info: https://us02web.zoom.us/j/93134299948. Meeting ID 93134299948. Phone 646-558-8656. Blind and Visually Impaired Peer Support Group, Friday, April 29th, 10:30 a.m. to 12 p.m. meet.google.com/BTC-KODI-GOV or call 929-324-9686. PIN 862481-761#. Feel free to share this information and Zoom links with anyone you think will benefit from these programs. For more information, or if you have any questions, call the Wrilc office at 330-372-3325 or visit our website at www.wrlc.org. to find staff members' emails if you wish to reach them that way, or use info@wrilc.org. Free Community Easter Dinner. Warren Family Mission, 155 Todd Avenue, Northeast, Warren, Ohio, 44485. Friday, April 15th, 12 p.m. to 4 p.m. The Warren Family Mission will be holding their annual Easter dinner Friday, April 15th from 12 p.m. to 4 p.m. It will be in person this year, and they are so excited for all to attend. The Easter Bunny will be there passing out Easter baskets and candy to all children that attend. The menu will be ham and pineapple sauce, mostaccioli, corn, stuffing, mashed potatoes, rolls, and desserts. Easter meal delivery is available. Call by April 8th, 330-394-5437. Section 7. Calendar items for April. April is Autism Awareness Month. April 1st, April Fool's Day. April 1st, Community Living Skills Workshop, 1 to 2:30 p.m. April 2nd, World Autism Day. April 8th, Community Living Skills Workshop, 1 to 2:30 p.m. April 12th, National Grilled Cheese Day. April 15th, Good Friday. Offices closed. April 18th, Easter Monday. Offices closed. April 20th, Stress and Anxiety Peer Support Group, 11 a.m. to 12 p.m. April 22nd, Community Living Skills Workshop, 1 to 2:30 p.m. April 29th, Blind and Visually Impaired Peer Support Group, 10:30 a.m. to 12 p.m. April 29th, Community Living Skills Workshop, 1 to 2:30 p.m. Thank you for taking the time out for our newsletter. Western Reserve ILC is a local 501c3 nonprofit agency servicing the needs of persons with disabilities in Ashtabula, Columbiana, Mahoning, and Trumbull counties. We are a community-based, non-residential agency whose core services are free. If you would like to receive a Braille, email, or audio copy of this newsletter each month, please contact us to find out more about becoming a WRILC consumer. You can call us at 330-372-3325.